Welcome, everybody. We're just getting started here. And I'm Mara Yale. I coordinate this educational series. Our topic today is about talking with kids about what's happened to them, their medical condition or story. Just a second, the view is confused. Okay, so go ahead and use the chat to introduce yourself or the three dots to the right, top right of your little rectangle, so that we get to see who's here and your role, whether you're a parent or a professional. And I'm going to share some intro slides and then we'll get started. So I'm really pleased to introduce today's topic, which is on talking with kids about their medical conditions. And we are bringing this to you from a team. It's a team of parents and clinicians, the Pediatric Stroke Advisory Council at Mass General Hospital, Spaulding Rehab Hospital, and we work with others as well. So I'm going to give a little history and context about this educational series as people continue to arrive, and then we'll very quickly go into the session. So as you all know, living with a child who's had a stroke or working with children who've had stroke or brain injury, this kind of injury to the neurological system has the potential to impact a child throughout their lifespan. And the care goes well beyond the medical context. So there's an acute event, which may or may not be known at the time of the event. And then there are many implications for how this affects one's life. Just a disclaimer, we are offering educational resources and information here, not medical guidance. If you have questions during the session, please frame your questions as generally as possible so that it's not specific to your case. And we don't want anyone to betray personal medical information. I just want to take a moment to celebrate where we've come from. So we started this educational series pre-pandemic in 2019 with 2 in-person events in Boston, and we were then able to reach only families local to the New England region. The gift of the pandemic to us was being able to take our show on the road, and I just was excited to learn that yesterday was our 4-year anniversary. So I hope that you'll all celebrate some of our accomplishments together with us today. We've delivered 40 sessions. Typically, we get 20 to 80 people showing up live. 18 of our videos have been shared more than 100 times on YouTube, or viewed more than 100 times. One has been viewed more than 1,000 times. The attendees come from many countries around the world, and we also partner with speakers from more than a dozen organizations. You can scan this QR code, or I'll put the link in the chat for you to access past and upcoming events. And just to highlight the upcoming events, May is Pediatric Stroke Awareness Month. We have this session today about how to talk with your child. And then the next session actually dovetails with that. It's really about transitioning to adulthood in the healthcare system. And then those of us who are in the Boston area or local to New England are coming together for our 2nd annual Play to Thrive event outside of Spaulding Rehab Hospital. And again, you can register for any of these events on this website or via the QR code. And then we also are participating in a 5K on June 4th. So with that, I will stop the share and hand it off to Lesley Carvalho, who's going to start with her family story.
Good morning. I am mom to 8-year-old son Roman, who had a perinatal stroke, and it's sort of been even during birth, and knowing that the road was unclear ahead of us. It's definitely always been something that, as a parent or a caregiver, that you think about, how will I have this conversation one day, and what will this conversation be? And we're here. He's 8, turning 9 in June, and definitely more understanding of his body and challenges, whether it be around learning or he has his right side is weaker, so his right hand is what we've lovingly referred to as his helper hand. And just having him open up and sort of talk with me, but also for me to share out in a way that he can understand. And just three key points that I wanted to talk over today is in just different ways that I sort of frame my conversations with him. One is age appropriate talk. 2 is helping to explain through his preferences, which for him is superheroes. And I can talk on that. And the other point in having these conversations that I always make sure that I communicate with my son is sadness and happiness can exist at the same time. So back to age appropriate talk. So again, our life has been spent on this wellness path and just doing everything we can to help Roman to be the best that he can be. And a lot of that over the years was occupational therapy and physical therapy in a swallow clinic, and as he, and constraint therapy. And as he transitioned through those different stages, he wore, as part of the constraint therapy, he wore a cast on his hand. So some of the language we would use around that was, this is your, he would call it his boo-boo, and we would go to see Victor at Mass General, who would make his new boo-boo. And in those moments, it was more from an innocent point of view, in terms of it was just a boo-boo, and it was a boo-boo on your brain. And that's how we started the conversation. Again, him being younger and not understanding what the word stroke or anything around that really meant, and then graduating to a brain injury, and then now starting to talk about the word stroke and what that word means, and what happened when you were born. And so I'm starting to just now at this age use the word stroke, which again is still probably conceptually hard for him to navigate, but I think he's ready to understand. And again, graduating from boo-boo to just sort of saying a brain injury, and now getting more specifically into the conversation around stroke, which that raises a lot of questions. And just the last week we were talking about it, and I really started focusing in conversation that would make more sense to him. And for him, his love for superheroes is so intense and so adorable. And I thought, like, what a great way to sort of talk with him about, this is your superpower. Like, you're the superhero, and you healing, your brain healing is in fact your superpower. And your left hand is your superpower hand, and your right hand is your helper hand. And like, this is you in this world being a superhero. And I could really see him like understanding that, and really kind of had some level of, pride in what he's navigated and recovered from. And so just continuing to kind of shift the conversation as I see him get older, and kind of talk with him about what is age appropriate, and kind of what ways can I talk to him that really play into what his current interests are. And for right now, it is very much that superpower and superhero theme. So he definitely received that well. And but also at the same time, encouraging him that happiness and sadness can exist at the same time. And it's okay to be sad that this happened. And he even asked me for the first time this past week, why didn't this happen to my sister? So that's obviously a great question and a very valid question. Why me and why not her? And, I just try to focus on that, this is your story and this is what makes you the most special boy that you are, and in recovering and healing. And Rio has different things that are hard for her, and everyone has something different that might be hard for them, or that they might be working hard to heal from, or that just makes them different. But I always tell my kids and share with them that different is amazing, and we always focus on the amazement and the differences, and not sort of any unfavorable feelings about being different. So that's definitely been something that I've always focused on, but definitely a unique conversation. And now that he's getting older and realizing that this happened to me and not my sister and not my friend, and not other people that I might know, but to really encourage him to have feelings about what happened. And it's okay that it makes you sad that your right hand can't do the things that you want it to do, or even in these ages where we're kind of engaging with different people, like a thumbs up, can only do thumbs up on his left hand and can't do it with his right. And just like I said, really encouraging him to focus on all the healing that has happened and the things that he can do. Learning is hard for him, specifically around math and reading, which was definitely shared early in the early days, that could potentially be a challenging place for him in learning, and specifically around math and reading, and which it is. And details are hard, and recall can be hard. And we just focus on, taking the time to go slow and to ask questions or to ask for help, because generally, like, people would want to help. And the more we communicate and the more we ask for help, the more that we know people are willing to help. And just encouraging him to really rely on his peers, peers in class that he feels that could help him, peers in life that could help him. But I think it's just another really important part of the conversation about stroke, and sort of, what health and physical differences that brings, is that it is okay to ask for help, and it is okay to be sad. And I mean, again, I think a big part of this, right, navigating what happened to your own body at a time where you were too young to know, and now you're at an age where we can have those conversations. Emotions are most definitely going to be part of this, and I just encourage him that when we're sad, it is most definitely okay. It's definitely a part of working through the understanding, and just that both happiness and sadness can exist at the same time, I think is just one of the most important parts in all of this. And just, like I said, as he does need help sort of navigating everyday activities, and just really encouraging him to focus on asking for help, and to be comfortable asking for help. He is most definitely one of the happiest. I say this all the time. His soul is so happy, which I have to be so grateful for, and I am. And I think that helps really kind of navigate these really challenging times when he is frustrated with some of the limits and some of the challenges that are before him, but yet to keep him encouraged in ways that are age appropriate, and that really make him understand how we're navigating this. But I think those were just three really helpful points to consider as we are caregivers and parents to anyone in your family that you're helping to understand what has happened with them. And so far, this is definitely helping our family. And thank you for allowing me to share.
Awesome. Thank you, Lesley. So I think that I'm going to talk a little bit about really trying to give you guys a bit of a framework of how to go about some of these conversations. I think sometimes just getting started is really challenging, and having a little bit of structure, some signposts and some things that you're going to try to work through and ways of doing this can at least help kind of get started. I'm going to try to target it primarily at us talking with the children, and obviously there's going to be differences depending on their age. Talking with a 7-year-old versus a 17-year-old is going to be different. But I think there's other conversations that happen in life around this with grandparents and with friends and with others. And a lot of times those conversations are just as difficult. And so I think you can utilize some of the points here really in any of those moments. So I don't have any disclosures. This comes from the cancer literature, the main place from a physician standpoint of how we've learned to have these conversations, which is definitely lacking in terms of the education, but it is out there. And it primarily started, honestly, in the 90s with the cancer folks. And this came out of one of the main leaders in this. And what they said was, if the breaking of the news is done badly, patients and their families may never forgive us. But in contrast, if we get it right, they'll never forget us. And I think that carries a lot of weight. These conversations matter. They're not inconsequential. They lead to ongoing feelings and thoughts about the disease and how they're recovering and what they think about. And so how it's done on that front end can really have long-lasting effects. The goals that I'm hoping to do, like I said, is identify a little bit of a framework to start having these conversations. Talk about the basics. And one of the primary ones is starting with an agenda and kind of joint goals. So what are you trying to get across? What is your child trying to learn? What you want to make sure that is clear by the end of the conversation, and recognizing that there's different things that come out, different data that you're going to see. There's the cognitive data, which we all understand pretty easily. That's sort of the numbers, the facts, the things that happen. But then there's the emotional data, and that's probably much more important when we're having these conversations. And that's what's going to help you get through these conversations and recognize how you can move through them in a meaningful way. So I've kind of said this already, but does it matter? Does it matter if we communicate better as we're going through these things? And the answer is yes. There's been a number of studies that have looked at this, and there's improved adjustment to illness. And again, a lot of this comes from the oncology literature and that sort, but they've shown decreased pain, decreased physical symptoms with better conversations on the front end around the disease process, improved adherence to the treatment, improved, taking of their medications, improved wearing of their brace, doing their stretching, all of those types of things that can be really helpful in the long run. But having an understanding and having a good feeling around how this all went can improve that kind of thing, and higher satisfaction with care when you look at sort of the physician side. On the other side of that, poor communication can increase use of ineffectual treatments where they're asking for things that really aren't appropriate and not that you want. Higher rates of conflict, and we see this in the medical setting and in the clinic. And I think that's such a limited part, but for growing children, teenagers, tweens with parents, there's already so many things that can cause conflict. Doing this in a way that isn't contributing to that, but potentially helping with that relationship and not battering it can make a big difference. And again, that adherence we had talked about. So why do we want to communicate better? You want to be able to deliver the news with compassion and clarity. Make sure that the things that you're trying to say are coming across clearly, and that your thoughts and what's in your mind is actually being expressed and not getting all jumbled and flustered. You want to be honest, and that can have a huge range. Stroke is such a wide-ranging disease. There's an enormous amount of clinical and different difficulties that children will have, and being honest with your children, with your family about what those are, but maintaining that hope and recognizing that we're going to move forward and keep improving as we go through. And again, feeling less flustered, words less tangled, and able to really focus on your child during this time and their needs, and make sure that you're addressing this conversation directly towards them. So the key is not breaking bad news, right? That's how this was always classically discussed, is this breaking of bad news. And at the end, when you think about that, and the kind of feeling that that gives me, at least, is that you're kind of giving this information dump. Here's the bad news. Now it's your problem to deal with. You figure out how to go through this. I think the conversation really is much more of a discussion. You need to be kind of back and forth. You need to be sending, receiving messages and making sure that you're following their lead and they're kind of guiding the conversation in terms of what they're ready for and how far you can move forward. This is not something that you're just giving them to sort of swallow and take in. This is something that you're helping guide them through. So this has been sort of it's a small book. It's a small paperback book, but this has been my guide through a lot of this. And I've read this book probably 8 to 10 times and have looked back before hard conversations, especially as I was going through. But it lays out a number of basics and the things that we want to think about in setting up and having a difficult conversation. And, they talk about a number of different situations. There's the big situation. You have a new diagnosis. Your child had a stroke. How do I express that to them? How do I get that across? But then there's a lot of smaller conversations on a day-to-day basis across the years of, we can't play contact sports. We're going to need to wear a brace. All of these things can be big conversations and really important to the children and to your families and to you. And so having these in a meaningful way and being thoughtful about it can make a big difference. The first thing that they talk about is setting that agenda and agreeing upon it, right? There's going to be goals that you have going into this conversation. There's also going to be goals from whoever you're talking to, your child, your parents, whoever it is. And so making sure that you're addressing both sides of those is how you keep moving forward and how you feel like you guys are on the same page. The times when we feel like we're not connecting is when one person is trying to get their agenda across and the other person's agenda is completely different, and there's been no reconciliation of those two things to make sure that we're on the same page going through it. The next step is kind of tracking that emotional data. So you really want to watch and register that emotion as you're going through. There's always that discussion when we hear about, I heard the term, cancer to go back to, and everything went blank and I didn't hear anything else. And that is vital to listen to. If you're watching and you're seeing that they are just checked out or they are overwhelmed by something, you continuing down that conversation path is not going to get anybody anywhere. You're going to be telling them things that they're not hearing, and you need to make sure that you're recognizing whether or not they're ready to move forward and how they're feeling about it as you go through those types of things. And that's kind of brings us to step 3. So staying with them, moving that conversation forward one step at a time. The beauty of having conversations with your children and that stuff is it all doesn't have to happen right now. We don't have to sit down and go through everything at one moment. We can have one part now, let them digest, come back and have another conversation at another time to dig into a little bit more details, to go through this a little bit further. Moving forward when they're not ready doesn't benefit anybody. The other thing, and this comes across in a number of areas. We see this in the rehab literature. We see this kind of across the board. When we were prepping for this talk, Mara had brought it up in a number of settings, but really talking about what you're going to be able to do before what you can't do. Spinal cord injury is a nice place for me to think about this. When we think about the level of injury, it's really helpful to sort of talk almost from the top down, not from the bottom up, right? We have an injury to your spine. You're not going to be able to walk, but you'll be able to do this. Is not a great way of starting that conversation. It's much easier, much better to say, these are the things that you're going to be able to. We're going to be able to, dictate our care. We're going to be able to feed ourselves. We're going to be able to do this. We're going to be able to do that. And then getting to maybe the things that we can't do if they're ready and if that's what they want to hear. But talking in that sort of top down, what we're able to do before we get to anything of what our restrictions are going to be is really going to frame the picture and frame the conversation differently. And I think with that, it comes with sort of where you should be focusing, especially at least initially. Big picture goals are going to be much more important. You really want to give that broad range of what are we thinking about? Adaptive sports is always a discussion, and I've heard it in a number of places where people are like, well, I can't do that anymore. I can't do these types of things anymore. And the big picture is you may not be able to do those things how you did them in the past, but you absolutely can get back to the things that you loved, or you can learn new things, or you can do the types of things that other children are doing, even if it looks slightly different. And so I think focusing on some of those bigger picture goals can really kind of reframe it and making sure that you're not getting bogged down on some of those details. Stroke, there's a lot that happens for our kids, especially our perinatals or our older kids. And parents are going to remember every detail of it. They're going to go through, and it was such a traumatic experience going through a lot of those details of the PICU, of any sort of procedures, the imaging, how hard that was, all of those things. Probably not all that important early on. If they have questions about it down the road, of course, we want to be honest, we want to be open with them. But making sure you're not getting bogged down on those details and thinking about the bigger picture and back to that agenda. What was the purpose of this? What was the reason that we were here? And then the last step, the last thing that we really want to focus on or think about is providing some uninterrupted, undivided attention to them. Giving them an opportunity, being quiet for a minute, letting them express their thoughts, their needs, whatever it may be, and making sure you're listening without interrupting, without putting your prejudice on it, without putting your thoughts in there, and letting them kind of lead that conversation for a period of time. So, when I think about the agenda, it sets up that conversation. And to some extent, when I think about this early on, when I'm having a conversation with a family I've only recently met, it really does set up the relationship. We want to make sure we're on the same page. And asking, you will know your child better. You'll know a lot about this to some extent. So you may be able to sort of set this agenda in a joint way. But what do they want to take away from this? And what do you want to take away from it? Making sure that everybody's on that same page is going to be really important. And then making sure you're addressing the correct parts, concerns. There's so many times where we go into these conversations and we think that their worries are about one thing, but it's completely different. And being explicit about asking what the concerns are and what we're thinking about, what's on our mind, because we may just be answering the wrong thing where they're kind of in a totally different space. And again, this helps establish rapport. This is, again, a little bit more from the physician side, but it does give that coordination, and it makes this kind of talk and this kind of conversation feel much more like a give and take and not so much of a information dump. This, I think, is one of the hardest parts about these conversations and often one of the scariest parts for folks. Responding to that emotion, worrying about how they're going to respond to the information you're giving them and what are you going to do in that moment. This is that difference between the cognitive and emotional data. You're going to be presenting a lot of cognitive data. You're going to be presenting initially some cognitive data, but you really want to be thinking about that emotional data. That's what puts importance on different topics. That's how you're going to recognize what's important to your child as you're going through. How are they responding to the different aspects of this? What are they worried about? You may tell them that they had a brain injury, they had a stroke. There's not a lot of response. It's not registering. They may be too young. They may not be thinking about it. But when you get into different aspects of what they're going to be capable of doing or what their restrictions may be, that may be the important part. Maybe they can't play hockey, and that's the biggest part that's going to come back to them. That's going to show you where their value is, where their importance is. And following that emotional data is going to be crucial through all of this. So how do we do it? We're constantly doing it. We do it all the time. We're all capable of responding to emotion. It's just being a little bit challenging. It's sometimes challenging when we're prepping for it and trying to make sure that when we respond to it, we're doing it in a meaningful way. Conscious use of emotional data is a skill that is really important to optimizing communication, and it's something that is learned and is improvable, if you will. And thinking about that empathy, and it's something that is real. It pops up on functional MRIs, and something that we can see. And it was just interesting, Lesley, as you were talking, that sadness is a big part of this. This was part of another talk I had given that was a bit longer than this, but why I pulled in the goodness, whatever movie this was, that's blanking me right now. And then the framework. So commit to observing, using that emotional data, noticing it and naming it for yourself so you know where you are with them. And then importantly, not trying to fix it or quiet it. That's not the role you have here. You're just observing it and you're just acknowledging it explicitly. Often it's really important to be explicit about acknowledging that emotion, whether that's verbally, non-verbally. It can be challenging. And so there are some frameworks for how to acknowledge this. One of the ones is nurse. The first step here is naming that emotion. And I put this slow sign because this is the place where people can get into trouble. You want to name it, but you really want to be soft with naming it. You don't want to look at them and be like, you seem angry about this. You seem really mad, or you seem whatever, you want to kind of step back, and it sounds like this has been frustrating, or it sounds like this has been really challenging. Kind of take a step down when you are naming that emotion to be thoughtful about it. And then understanding it. And again, the thought with all of this is to be explicit about these things. And it sometimes feels awkward. It was definitely, it still is a bit awkward when I'm going through this, but I try to be thoughtful as I'm doing it. And, you know, understanding it must be hard to have difficulty with, you know, playing soccer or doing whatever it may be. And then respecting them or praising them. There's always something amazing that everybody is doing through these things. And it can be as simple as showing up. It can be as simple as having a good attitude through it, or it can be as broad as excelling in a situation that's really challenging. And then supporting them. And I think that's kind of the key here, right? Especially as a parent, just making sure it's clear that you will be there regardless of what it is that happens, regardless of how they do, regardless of how they respond to it or how they handle it. You're going to be there for them. And I know Dr. Mussolina talks about this all the time, but you're building a team. They're going to have a team around them of whether it's physicians or therapists or teachers or counselors or friends or whoever it is. There's going to be a group of people that are supporting them and behind them that can help them through these different things. And then, you know, opening it up and allowing them to explore that emotion. You know, tell me more about how this makes you feel, how this is affecting you, how you think about this and those types of things. So again, naming that emotion, just being cautious with your words with it, and understate that emotion that you may see. Not you look furious, but I'm wondering if you're concerned. And I think especially as we get to some of our older teenagers and that sort of being cautious about labeling things can be really important. This is just another, I'm going to go through really quickly of kind of how to set up the actual conversation. You know, we talk about spikes, making sure that you have the right setup. Are the people you want there? Are you in the right place? Is this not being done, you know, in a car that's going to get interrupted or with the TV on, that kind of thing? Assessing their perception and understanding. You know, you're going to know your child, but it may be worthwhile asking them very specifically or very pointedly, you know, what do you know, especially as they're getting older, as they're learning things that may be out of your purview and out of your timeline. And then asking for that invitation to talk. And I think this is important, especially as we get with our older kids. Giving them a little bit of control in the situation is going to be key. A lot of this feels like they're out of control, and making sure that they feel like they can stop it or they can let it go to any extent is gonna make them much more open to participate in these conversations. You know, when you have the conversation, using simple language, making sure you're in line with the goals of that conversation that you've thought of on the front end, and then responding to that emotion. One of the things we talk about is summarizing the plan. And I think the key here is thinking about what the next steps are. Do we need to have a further conversation with the neurologist? Do we want to have another point where we talk about this related to a different aspect? Or do we just need to readdress the things we've talked about here as we're going through? So that's it for me. I hope that's helpful. I'm going to pass this on to Matty and let him dig into some of the aspects, and we'll go from there.
Thanks, Brian. I think it's great to, you know, hear from all the different perspectives. It's one thing I love about this group and this process that we've been on together. So awesome. Hi, my name is Matty Wilkinson. I am a Feldenkrais and an Alpanya method practitioner in Arlington. So it means I work with movement and the brain and learning with children with disabilities in private practice. And I've been part of this group since we started. And Mara just reminded us 4 years ago, we had our launching of this series, which was in person to begin with. So it's awesome. So as we've been talking about this topic for a long time, thinking about it as something really important that we want to address, and how to do that. And my role today, I kind of have different hats. Part of which is, I mentioned my work, but also I have a child development background. So I'm gonna kind of be addressing or thinking about with you some things to consider when thinking about how to address these kind of conversations with young children in particular. So my part's really not intended to be like a how-to piece. It's really like more about provoking thought, our own reflection, our own questioning and conversation amongst the community, amongst ourselves and others who might be have stake in this topic, because it's super important, and as you mentioned, Brian, like really not widely addressed, I think. So not nearly as widely addressed as it should be, I think. So let's see. In terms of child development, for many years I was a preschool teacher in California and then in Massachusetts, and worked with kids with and without disabilities in inclusion classrooms. And one of the things that I was really interested in during that time and celebrated was how differently children think and feel about some things than adults. It's particularly young children. So you know, and not only that, but as they develop, how their thinking and their feeling about a topic evolves. And I think Lesley talked beautifully about that in terms of, you know, it's a long-term process, and we'll hear from Mara as well. And that the child's understanding and the conversation is going to evolve over time. And I think that when we're thinking about these kind of topics, especially as a parent, something that can be so emotionally intense, and Brian, you were talking about emotion and tracking the emotion of the person we're talking to, but we have emotion also, right? And we come to these conversations with our feeling. And one of the things Mara and Patty and I were talking about was this idea about having the time and the space to process, to feel, to reflect on our own feelings apart from that conversation, so that when you're having the conversation with the child, you can actually see and be present to and engage with how they're processing it, which will likely, especially with a young child, will be very different from how an adult may be responding. So you know, as a preschool teacher, my training and my interest really wasn't about imposing an adult way of thinking for the children. It's really more about giving them access to information and experiences that help them, they're accessible to them developmentally, and help them make sense of themselves and the world. And then understanding and being curious about how that changes over time. So that's kind of the lens that I'm thinking about this topic through. I love the question about Brian posed about, you know, what do we want, what do we hope for them to get out of this conversation? I think that's a really interesting thing to reflect on. And so what? So yeah, I mean, what in terms of this topic, what is it that you hope or we hope for the child to get? And I really want you to think about that, or invite you to think about that, and take a moment to use that as a guide for how you then approach the conversation, which Brian spoke about. I guess some things that come to mind for me, like self-knowledge. We want children to understand themselves, their experience, to have compassion. Lesley talked about it. Also, you know, having compassion for those things that are hard and knowing it's okay to ask for help. And also being empowered. I think, you know, because of my work being about the brain and learning and change that happens through experience, I'm always sort of oriented towards empowerment, towards a realistic but optimistic way of framing these topics. So let me think about Yeah, I guess I want just sort of overview of that. It's like how to use language that's simple and accurate, but is accessible to the child in their stage of development. That helps them make sense of themselves and their experiences, and also leaves space for the child to have their own experience, their own thoughts and feelings about this this topic, and is also empowering and recognizing how adaptable they are. So in my work, because of the work that I do with movement and learning and change in the brain, and how we learn through experience, I use a learning mindset to talk to families and children about these questions. And what that means is thinking and recognizing really that the brain is not fixed or rigid, that it's incredibly adaptable and flexible, and that actually something I've heard Dr. Mussolino talk about, which I love, is this that the adaptability and the changeability has tremendous value, and that by learning to adapt and adapt, and you talked about superpowers, Lesley, but like by learning to face challenge and then find ways around, it's an incredible gift to or not a gift, but it's an incredible contribution to all of us, actually. So it's something to celebrate, I guess, is what I'm saying. And Omara, when I were talking about this, she was saying that these kids, in thinking about a learning mindset, so if you can frame the questions around learning, around change, and around possibility, that these kids of all people need to know how the brain works, like possibly more than anyone else, right? And then I would add to that we as their caregivers or as parents, we need to know that also, because not only for the shepherding them through the challenges they have to go through, but also that all of us, and certainly as parents, we all know things are hard, and you have to approach that and if you approach it with a learning mindset that's recognizes that you can change, that you can develop, that you can learn, I think it's an empowering way to frame these conversations. So the last thing I want to say was just, if thinking about this for young children, thinking about the frame of a story, like as a way of understanding this this topic, and how we learn about ourselves through stories, we learn about the world around us through stories, and and stories are how we transmit values, actually, how we learn about how we and others handle challenges that we face. So children are in the process of developing a self-image, right? They're in the process of developing understanding of who they are, and that books are one way that happens, but also the verbal, the spoken, and the shared stories that happen over the course of their life in relationship with you or other caregivers are an important part of how they develop that image of themselves. And I think that if the story that we create can be simple, can be real, and honest, but help them understand themselves and their experiences, and also be empowering, and have optimism, or have really real optimism, because we know that the brain changes all the time. If it can have those qualities, then it's really a story that serves the child, which I think is a goal that we share, right? We want, it's for them. And so that's yeah, that's what I wanted to say. Thanks. Amara, we're passing off to you now, right? Yeah. Look forward to talking more as we discuss later. Yeah.
Thanks, Matty. So as I introduced myself, I coordinate this educational series, and I'm also mom to an almost 14-year-old child who had a perinatal stroke that was diagnosed at 2 or 3 days of age. So I'm going to share some stories and kind of like a case study, expanding the age range beyond what Lesley offered with her son, who's 8, almost 9. So first off, I was coming into parenting as an older parent. My first child was 2.5 when I had my second child, the one who had the stroke. So there was also an older sibling who was asking questions before the child who had the stroke had the ability to ask questions. So I was coming in with an awareness that differences about a disability or a medical condition are just like differences about family structure that preschoolers are quite aware of. They're aware of who has a mommy and a daddy, who has just a mommy, who is getting picked up by whom at daycare or whatever context is in their lives. So we had language in our family about all families are different. This is who's in our family. And it was very affirming. It was not talking about who is not in our family. Our family happens to have a mom and 2 kids. So that was a frame of reference when I started to talk about other things. So the first thing that happened was really during the acute phase. My older child had met her baby sibling at the hospital at like 1 day old and was very excited and got to hold them. And then all of a sudden, I wasn't coming home and the baby was in a different hospital. And my 2.5-year-old said, "Where's my baby?" And that went on for like a week until somebody said, take her to see the baby in the NICU. And I was able to do that. And even a 2-year-old can understand the baby's alive, the baby's breathing. I can still touch the baby's okay. And for my 2-year-old older sibling, it was really important to do that. Briefly, it was like not an extended visit, but that was an important step to take. As Matty talked about, and also Brian, we try to keep the language kind of neutral and factual. So I like to tell the story of the first time we saw Dr. Mussolino in the stroke clinic, which was, we had been going to the stroke clinic, but nobody there up to age 6 had ever asked my child anything directly. And at that appointment at age 6, Patty asked Echo, "Do you know why you're here?" And Echo at 6 could say, "Yes, because I had a stroke in the left side of my brain and that affects the right side of my body." And it was simple, age appropriate, using actual medical terminology. I don't know that Echo at 6 knew what a stroke was, but they knew that it could be in one side of their brain and that it affected the opposite side of their body. And so, and that was based on, again, like what Lesley was talking about, sort of progressive conversations at with age-appropriate vocabulary and complexity. The next topic I want to talk about is sort of invisible versus visible disability. So a lot of kids who have early or very young stroke or brain injury, it may not be so visible unless they're wearing some kind of splint or constraint or AFO, and then you start to get questions. And the questions often, people jump to conclusions that are not accurate. So my child was wearing a splint for constraint-induced movement therapy at 12 months, and we were on vacation, we were at a farmer's market, and every person we passed wanted to know why my baby was wearing a cast. And I found myself like, they were shocked that this baby had a cast, and then I wanted to be truthful, or I thought I wanted to be truthful and say, no, actually my baby had a stroke. And then they were shocked. And it was kind of alarming until this wise woman at one of the stalls at the farmer's market said to me, you can pick and choose who and how much you share. And it was a really good lesson for me to manage my own emotions in that context, because each of those conversations can be expensive for the parent and eventually the child once they are old enough to understand that conversation. So I really started to think about what to disclose and when and why. So it's one thing to have conversations with your child. It's another thing to have conversations about your child with your child present. And for that, I felt like I was figuring out for myself how to model disclosure, when to disclose, when not to disclose, and also consent. So as my child has gotten older, I often will check in to see if I have their permission to share their story in different settings. And if so, even to discuss with them the language that we use. And I think I'll leave it at that. I want to share one more slide as we invite you all to put questions in the chat. And I know there are some in a minute. So let me pull up this slide. We run on a lot of volunteer effort and some fundraising. So we have a couple of opportunities to contribute. One is for local people who want to join a 5K or contribute toward that. And the other is to make a donation. And Claudia has put links to these events in the chat, and we can do so again as the event, as we take questions and answers. So
happy to. Yeah, I would just stress on those links that these programs were not available when my son, who's now 22, he had 6 strokes beginning at the age of 10, and there were 0 resources. So this entire series is incredibly powerful and has reached really over 1,000 people who have watched some of the videos. So I would really encourage anyone to click on a link, become a fundraiser, make a donation. Any amount will have such a huge impact on us reaching families and caregivers for these wonderful children. So I'll put the link in at the end. So thank you.
thank you, Claudia. I'm changing the view to gallery. I invite you to come on camera to create community here. And we have time for some questions and discussion. And then we also have some additional speakers who will chime in if we don't have enough questions, including Barb Luby, who's a social worker at Mass General, and Patty Muslino, who's our neurologist. So I do see one question from Angela. Angela, do you want to ask your questions? Actually, it's a couple of questions.
So I'll ask my question. And I'm sitting here, I'm the grandmother of the child in question, and I'm sitting here also with my daughter, her mother. And I'll just read it to you as I posted it. This is regarding 4-year-old Rosemary. She did have meningitis diagnosed at 5 days old. And while she was there in the pediatric ICU, she also had a stroke, a right parietal stroke. She today, now at age 4 and almost 4.5, has cortical visual impairment. She has speech delays. She has low tone, which results in some balance issues. And on top of the visual impairment, causing her to have an atypical gait. She does walk, but her gait is not typical. And she also has age appropriate, I would say, cognitive abilities. So we noticed just really in the last year or maybe more that sometimes we might be having a discussion with a doctor about her whichever her history and what she's got going on at present. Or we might be even talking to a family member to explain her CVI. And we have started to notice that she's over there, looking and listening. We can tell she's listening. And we've started to have conversations with each other saying, oh, wow, like she's listening. We need to step this up here and maybe have some kind of age appropriate comments to make to this little 4-year-old. And we do want to stay mindful of the fact that, we can't explain her vision to her. She will only be able to explain that to us someday, we hope, because it's different for everyone with CVI. And we don't want to pepper her with, I think somebody else, already said this, that we want them to have their own experience of it and to be able to communicate that to us. And so I guess my question is, going back to the beginning, that she's 4 years old, and how do we begin to sort of incorporate this into our regular conversations so it just becomes part of our dialogue and, not some big conversation that has to be had at some point in time? That's my question.
So I'd love to have Patty jump in if you're available, just from a clinical point of view, because I think you do it really artfully.
So first of all, you said something, very thankful that you both guys are here. Let them tell us one day, even if we have to wait until that starts happening, what they see. And you said like people with visual cortical impairment see differently. In reality, we all see different, okay? The way that we cognize the brain captures and makes sense of things that we see is very unique to each individual. It may be more challenging to decode an environment for someone with cortical visual impairment. And that's what I think you were referring to. But first of all, I wanted to affirm the fact that you see that who really knows and who should be educated is us about their experience and not us telling them what their experience is. I think I really want to highlight this point. Is a lot of wisdom right there that I think we can share here. And I also try to do that, listen a lot before I come up with what even question is going to be to the kid. To try to understand how is this kid talked to, what kind of like personality, or at least in the clinic, it's a very artificial environment, to be honest. Barb has a lot of conversations in different settings, which are sometimes more helpful, sometimes not, because it's inpatient, is when the kids are very sick or when the parents are very stressed out because they have to juggle their households, the kid in the hospital and everything. But listening first, I think, is my first word here, which has been resonating by every single speaker. And then I learned something also from someone in MGH who was an emergency room physician and did palliative care for many, many years. And not ever assume you know what they want to know or what they even mean with a question. And the best that you can do a lot of times is ask the question back in a different way. So you understand that you're asking and talking about the same thing when they have a question. And the very basics, sometimes the opportunities come from what the kid is doing. And I'm sure because of the way you spoke that you've seen this on this kid. For example, you're trying to get for a kid with cortical visual impairment, sometimes locating in a room or in the table that they're playing or they're eating may be different. And by observing them on how, for example, they reach to an object on the right side of the world, on the left side of the world, we always have visual fields and things that are crossed in the processing in the brain. So it's always good to keep an eye on asymmetries or things that may be more challenging on one side and not in the other, on a preference. So the kid that turns to always look towards one side, or if they go and sit in a room, they pick a specific spot all the time. They're comfortable in one place, and then ask questions on, is that more comfortable? Not what are you doing there? Like, the question is not like explain yourself. Is that more comfortable? Does it make it easy? Or if they grab something, and you saw them, they had to go with the other hand, and they turned their head to get that place that is less challenging to process the information. I'm talking specifically about cortical visual processing because it's your child. Ask questions as like, is it easy if you look it up with that, and see if they noted anything. So before you start explaining anything, do they have any acknowledgement of what is different, or if there is anything different? So that, I think, is a very specific thing that you have to find first. And with my question is like, do you know what you're doing here? The first thing I want to hear is, what is their own sense of why did they end up in this role? So for a kid at home, maybe, is it easier if you grab it with the right hand or the left hand? Or there are questions that you can ask to see if they really noticed there's something that is different. And I don't want to make it that is abnormal, that is worse, that, oh, is it easier and harder? I think it's normal in life. We have things that are easier and things that are harder. So I don't try to connotate. It's always the emotional state that you guys transmit, by the way, more than the words. But I think easier and harder are still okay questions. But do you prefer that? There's always a positive way of asking the question too, without bringing our own fear of negativity, that's not right. Okay, that is abnormal. The way that I think about any disability or any recovery after brain injury or any injury to any kid or any development aspect, to be honest, is that we are all very unique. Even in what we call the neurotypical children, they all learn differently. They all learn with like hinges on very strong pillars that they have for multiple reasons: genetic, environmental, familial, educational. And then they have other things that they go more on like a cautious kind of approach or not at all. So learning to see what they're trying to do and asking them questions. And even when they ask you a question, is this how I'm doing it? The answer could be, what do you think? You know, and then you start really learning about that. And then forget about cortical visual processing as well, the thing that you're trying to explain. This is what would be I have to do this myself. I could go deeply into the anatomy and trying to explain to the kid that you got the cortex that computes the vision, and that's why you don't see. You're talking about almost a foreign language probably to them, because it's their own body, their own world, and their experience. It's very unlikely that they have a sense that this is abnormal. This is how mostly it's a 5-day-old injury. They're born, they're learned, they're troubleshooting, they're resilient. This is them. There is nothing in them that is wrong or bad or insufficient. So it's us learning to speak what is helpful and unhelpful to them, the most difficult part in these conversations. And I'm saying a lot of things here that are not answering specifically the question, but I'm saying, don't think about explaining cortical visual processing to the 4.5-year-old. Ask questions back instead of giving answers first, to really know what they're interested in knowing and get to know them by observing, and maybe asking questions that are very subtle on the past, whatever activities they're doing, to start seeing if they have started to notice there is something different with a certain type of skill or development or learning. And sometimes that happens when they start with the peers, and this is this age. So when they start noticing that someone doesn't have an AFO, or someone doesn't read or write or grab the pen the same way I do, that's when they start pondering things. And you can even ask, like, I saw you look at so and so. Do you want to ask the question, or do you see anything different? Do you see anything different? And that's how you start knowing if they have a recognition, a cognition of something being different in themselves. And then that's when you can start talking. And then telling a story. I love the fact that we learn by stories. This is so helpful. Don't have to make it about scientific stuff. We just can make it your own story, and your story will be fine because it will be the way that you can tell it.
Thanks so much, Patty. I want to use that transition for stories to get Lauren to ask her questions, and I definitely have something to say about the second question, actually about both. But go ahead, Lauren. if you're,
Hey, hi guys. Sorry, I'm struggling to get my camera to turn on my phone, so I apologize for that. But first of all, I just want to say a huge thanks for even doing these sessions, because I've been on multiple of them and they have been really fantastic. So thank you very much for taking time to do these. So like I said, my 7-year-old loves books. He had a perinatal stroke, so he has right-sided hemiparesis. And I really have been trying to find books that help explain the stroke and explain that injury and then the subsequent physical impact in a way that is positive. And I have explored various books, but I haven't always they haven't always been positive, or they've introduced things that we haven't yet experienced or issues that he's not yet experienced. And so I don't want to prematurely add a concern if he doesn't have it. And so I'm curious to know if you guys have any books that you recommend that you enjoy for your kids. And then the second question that I have is, for those of you that have experienced kids that have decided that they no longer want to go to so many appointments and they just want to play after school like all their friends get to do, how have you managed through this?
so I'm going to jump in on both of those questions and then we'll see if others want to add. So there is, so I would expand like your list of books that you're looking for to include books about kids are different. The picture books that I love are by the author Todd Parr, and he does a beautiful job about different kinds of families, different kinds of abilities. So that's just sort of like inclusion, introducing the concept of inclusion broadly. And then there is, and I also want to invite anyone who's still here to put your favorite book recommendations in the chat. We do have a parent who's compiled quite a list, and looks like Lauren just got knocked out. So we will post the list when we post the video on our resources of books that are recommended. There's one grandmother who actually sent me a book that some parents wrote with their child who was a little bit older, and I can include that also. It's in like a PDF form. It's not published as a physical book, but it's pretty detailed, and I think that you can edit it, to read it in sections as it feels age appropriate for your child.
Thank you.
If your child's old enough to be pushing back on so many appointments, I would listen to your child.
Mm-hmm. Mm-hmm.
I would follow their interests. I would expose them to as many community-based activities that you can. Dance, music, sports. We have several previous recorded sessions on adaptive sports. We'd love to get them into CP soccer, for example. It's hugely powerful, even if it's not their preferred activity, to be with other kids who are like them, wearing AFOs, having a hand that's postured. So start to explore, if you haven't already, other kinds of activities. And then I would maybe have conversations with the medical team about which appointments are really essential and which appointments are more discretionary, and explain to your child there are some things we just have to do, and there are some things where we get a lot of choice. So that's, I like, with an almost 14-year-old, I have that strong stance. And I'll tell a short story. So my kid did constraint therapy from like 12 months to 2.5 years, and they didn't have a choice about that. That was something I decided we were doing. We were getting dressed every day and putting on the splint for 2 or 3 hours. And when they could take the Velcro off of the splint with the affected hand, I decided at 2.5, 3, they had earned the right to not do it anymore every day. But they had the splint in their bedroom. And at 6 or 7, they started playing with it. And I asked them, and at that point they had a goal for one of their sports to get more function in that hand. And so then it was driven by them. We found a camp that could support their goal. And with that intrinsic motivation from even a child of the age of your child, the interest and the motivation is just so much higher than if they're being forced to do something they don't want to do.
I appreciate that. And yes, absolutely. I'm completely aligned. And I really love the terminology of essential appointment and asking the physicians about that and using that term. So thank you. I appreciate it.
And Lauren, the other thing when it comes to the therapy aspect of things, you know, as kids get into, your child's 7, is that correct? As they get into sort of that age, elementary school, you know, we really try to push our kids more to this episodic nature of therapy and really goal oriented, right? And so those goals can be determined with them. Like, what do we want to get better at? And we're going to do this for this 6 or 8 week period, working on this specific goal and then stepping away. So you're not in therapy every day and they're not getting pulled out, because you know, there's so much more that needs to be learned than just some of the motor stuff. And that is the age where a lot of the social stuff is being developed. So that time with their friends, that time on the playground and learning how to interact is just as important. And I would prioritize it almost just as much as any other therapies.
Thank you for that.
Giselle, it looked like you asked a question and then said that Patty answered it. Do you have more to ask?
No, it's fully clear for me.
Okay, great.
It's the way I'm doing it, and I just needed someone to how do I say it, Patty? To confirm to confirm that I'm in a good path.
Yeah. No, and
Thank you.
then a lot of it, and I don't know if you guys heard it when Mara was talking, like this thing of being in the farmer's market and feeling that I somehow have to say something to people. Like, there's a lot of things that we doubt ourselves because we are having to walk the world and figure it out for our own. It's very helpful to hear that pretty much there's nothing wrong with a kid. Second, it's okay to be different. And most important, I don't need to be talking about it. What I have to be more focused on is, how do I feel that that kid is feeling itself, interacting with the world, and do I really need to speak because I'm trying to be that communicator while they're trying to find their world and the resources in the world. But a lot of what we're doing is learning from each other here. Like I also remember from the last time we brought this subject in one of the questions, the parent that says, we don't try to make braces something that is making you faster, superhero or anything. We just talk plainly about, this is what it is, this is what it does. We like that kind of thing. The kid takes it very well. And I was like, perfect, that's the point. There is no formula. So whatever you guys are hearing and also reading and a book, and it's easy to go through something that resonates with a part of yourself and then take it as a kind of prescription. Don't do that. It will apply to one day, it will not apply the next one. And if that's the case, you're on the good track, because that means the kid is developing, it's changing every day. You are changing as a parent because you're developing a relationship with this child. And that is a really good sign that what worked yesterday doesn't work today. And I had to think about something new. It's a really good sense that things are changing. There is development happening. If not, you start getting into kids that just can only deal with one way, which happens after brain injury, by the way, that they have to reduce their repertoire to be able to do things, to have this economy, to be able to keep going and learn. And they're working maybe on walking and they box one thing and they only use few words for a month and months at a time. And then they master the whatever they were doing with their gait or walking, and then they go back into that and it explodes again. So being able to be patient, observant, and patient with yourself and just ask questions, I think, is the most critical thing. And affirm when you feel things are helpful to your child. If you see the kid being calm, relaxed, and happy, you're really doing a great job. And I say this because of the books tend to, not the books that you would read to kids with the stories, I'm talking about books that you can read of how to do this, or how to be a better parent, or how to talk about a kid with disabilities. There is always something that may be helpful to someone in those things, but don't take anything as a predicament or a prescription, because it's not going to be static process, and not everyone is the same. So that's what I try to do also, is I do it for myself. In medicine, just to give you an example, we have textbooks, okay? And textbooks are the big, thick books that have consolidated all the information. And then we have papers, which is the thing that happened like just last minute. The textbook is 5 years behind, just to give you an example on whatever we know. And there is not a single thing in textbooks that we haven't gone back and forth over the last 100 years, or since we first started talking about how this thing works. So a little bit of humbleness about even what's real knowledge helps here. It just allows you to see more and more for your own, what is your experience, what is the kid experience, and what is needed at the moment, which is, I think, goes a long, long way.
So I want to give Barb a chance to talk. We have some older parents with older children in the audience that I know of, and I know some who will tune into the recording. And I just want to ask Barb, are there topics that we haven't touched on that really impact kids as they're coming into more independence in middle school, high school, or beyond?
Well, that's a huge question, right? But I think as it pertains to this group, what I find super helpful, and this is going to sound probably counterintuitive to all of you parents, is it's so important to figure out what you need to be your best self and to be the best parent you can. Because whether your child is neurotypical or atypical, it doesn't even matter, right? Kids growing up, becoming adolescents, really, really challenging stuff, right? And of course, you want to do the best you can. And sometimes, well, oftentimes you can do a really great job, but what gets in our way is we get triggered, right? Fight or flight, we get anxious, we start freaking out. Even if it's internally, even if we're not showing it on the outside, because you love your child, you're worried, you don't want them to experience, difficulties, anything that they don't have to. And, this is another conversation, but, the generations are different in terms of their perspective on how much they should shield their child from tough stuff, right? But what we're starting to see are some of the ramifications of kids not being able to develop coping strategies, to handle the challenging stuff. If it's not a stroke, it'll be something else, right? So, and everything has its different degrees and all of that. So when I work with families, my work is predominantly around the parents, helping them get what they need. And it's counterintuitive because you don't think about yourself, right? You're completely 100% focused on your child. But you are human, you are still growing yourself. Have you ever had a child before? And have you, your oldest child, they're the one that made you the parent, right? We don't know. We kind of just wing it. And meanwhile, we also have sometimes some unresolved things from when we were a kid, right? That we're still kind of struggling with, whether we know it or not. So I think as your kids become teenagers, to start getting some support for yourself, so you have a baseline, and then you have all of your tools and resilience to be able to better meet the challenges that are coming your way.
I love that answer. And it can be that you're starting to notice something, that your child's struggling, and your first impulse is to direct your child to help. And if you instead direct yourself to some additional help and support, it can lower the temperature. So it's easier for your child to find their own way. And sometimes I have teenagers now, it's helpful to find supporters for your children who are not you, through counselors at school or in the community, so that you can work with someone to get the message across, but it's not coming from you, because developmentally they don't want to hear from parents at certain ages and stages all the time. So we are winding down. I don't see any other questions here right now.
Laura?
Yeah.
I wanted to say one thing, jumping back to the comment Angela made. I don't know if I think you're still on, Angela, about your granddaughter. Is that okay, Mara? Just quick thing.
I am still here. Yeah.
Okay. Yeah. I mean, I think it's a great, the story that you told about her listening, you noticing her kind of quietly playing and slowing down and listening to the conversations. It got me thinking about like how that actually is kind of an opportunity also for you to say, if you notice that, and if you feel comfortable with having a conversation, whether you could say something, you could say, oh, it sounds, I wonder, it seems like you're listening. Are you curious about what we're talking about? Or do you want to be part of this conversation? Do you want to, so it's kind of, it just seems like an opportunity, like she's picking up something. And I would, as far as responding, it's one possible way of using that actually as an opportunity to start having some kind of a conversation with her that feels, in a way that feels appropriate or safe for you guys. Yeah.
That's a good point. Yeah, I'll have to think about that, because now we're feeling like, gee, maybe we shouldn't. I think we're probably going to be really dialing back these conversations. Not that we don't, we're not trying to keep anything from her, but that's not the way we want her to be. That's not the way we want to broach the conversation with her, is that she has to listen in to what we're saying to other people.
Yeah, no, I agree. I think that's sort of what I was saying. Maybe I didn't say it clearly, but no. If she is sort of third, like hearing sort of on the periphery something and is interested and is not involved, then that seems like something to deal with. That's all.
Yeah, no, that is a good point, and we'll think about how to best use that maybe to an advantage. Yeah, thank you.
You're welcome.
Thank you so much for being here. And again, I want to invite you to come to our next virtual event, which is May 12th. And the topic is transitioning to adult healthcare. I know that might appeal to a somewhat different audience than is here now, but I invite you to think of it as, if you have younger kids, they eventually will grow up to be adults, and everything we're doing along the way sets them up for managing and advocating for themselves to the extent that their abilities allow. And then for those who are in the New England region, we have these in-person events coming up, and we would love to see you, to play with your kids, and really celebrate Pediatric Stroke Awareness Month in person with you. Thanks so much, and I'm going to close the Zoom now. Bye.